Yeah, first of all, thanks a lot to Deputy Stanley for bringing forward this motion. It is striking that oral health is not much discussed in this House, I think, and it reflects a neglect that exists within our state, whereby we know that oral health is so important for overall health, for well-being, and yet it's neglected and it's seriously under-resourced in our public health system. If your teeth and your gums are healthy, you are less likely to suffer from heart disease, less likely to suffer from cancer, less likely to suffer from chronic respiratory diseases and diabetes. Dental care is a key part of preventative health care that can keep everyone healthier for longer and lower costs, actually, for the HSE. At least it should be. Unfortunately, in Ireland, it has been treated as a luxury, only accessible to those with the ability to pay to see a private dentist. And that scandalously goes for children as well as for adults. Public dental care is extremely limited, with long waiting lists, fewer and fewer private dentists accept medical cards. Children are meant to be seen in first or second class, but often this doesn't happen until secondary school. A mother of a child with additional needs recently contacted me in relation to this. She said, "We are currently paying a private orthodontist to help with our daughter's teeth, as she urgently needs early intervention treatment and we cannot wait for the HSE. When I called the HSE, they said they couldn't help and she would not be seen in 6th class as the backlog is so big, and that they would wait to see her for the first time in 2nd year, most likely. If we wait for this, my daughter will most likely need more intensive treatment and other treatments that wouldn't be needed if seen when it's required. The HSE are currently only seeing kids for dental problems that are causing pain, so basically when it's too late. All the waiting times are very frightening and the kids have been failed so badly right now. I just have to stand back and watch my daughter be failed with multiple issues, and it's absolutely heartbreaking that I can't do anything else to help her." And that is if not a common story, elements of that are definitely a common story that I hear again and again. The complaint that you don't get prioritised in the public system until you're experiencing pain, i.e. When it is too late. The fact that kids have to wait and wait and wait to be seen, and then forced to go private if they can afford to go private, or in many cases get loans to go private. The cause of all of this unnecessary suffering is deliberate underfunding and understaffing of our public dental service by successive Fianna Fáil and Fine Gael governments. They have pursued a policy of privatisation by stealth. Public dental care in this country was never great, but it was decimated after the last crash by austerity cuts. And that policy of starving the public system of resources continues today through the HSE Pay a Numbers scheme, which guarantees that there are never enough dental workers to staff the system properly. There's also nowhere near enough dental training places, and there's inflexible working conditions which force dentists into private practice or force them to emigrate. We still in this country don't have any dental therapists, a midway qualification between dentists and hygienists that exists in many other countries and could help fill in the gaps. The solution is to fund public dental services properly and to train and recruit hundreds of new public dentists and dental therapists. Public dental care should be available to all, free of charge, as part of a universal, single-tier national health service. There should be no limits on care, as proposed under Sláinte Care, which has still not been implemented. No one, obviously, is going to the dentist for the crack. So the right-wing argument that free healthcare will encourage overuse is even more wrong for dentistry than other forms of healthcare. Free dental care, free healthcare would encourage people to go early, to have prevention rather than cure. We know that prevention is always better than cure. Even from a cents and euros point of view, it makes sense financially. Regular free dental examinations, treatment from an early age, preventing more serious problems later on makes obvious good sense. The only argument against it is an ideological preference for privatisation and for private profit. For Fianna Fáil and Fine Gael, these will always take precedence over public health. So what we need is a renewed mass movement for universal free public health care, including free oral health care. A left government is needed for this change to happen, together with that mass movement. Thank you.